Hi, I'm Fran Silvestri. I'm the Chief Executive Officer of an organization called the International Initiative for Mental Health Leadership. And I'm sending you this welcoming message from my office in Auckland, New Zealand. And I just wanted to welcome all of you to the National Psychosocial Support Seminar. I really want to tell you that we really support what you're doing. And I've been able to talk with MHEI, who is the Chief Executive Officer for the Mandate Health Empowerment Center initiative. And he's explained to me quite a bit about what's going on in your country. And I first want to say how sad I am that you have had such conflict there and that there's so many displaced people living in the camps. I also want to say that we want to help when we can, providing you some information and being able to help you with some supports. But we understand that you are the experts. We really don't understand in the details of the struggles that you're going on. And so we hope that we can give you some assistance, at least in the materials and in some mentoring if we can do that. I do want to just quickly say that I'm so impressed that all of you have been meeting and want to meet today, because I think that's such an important part of solving the issues. There's two philosophies that I've always felt. One is that we all agree on a set of values, that is what we believe in, and that we all agree to that. And if we agree with those values, the second principle is that the information that people give you, or experts who come in to talk with you, they're a help, but really the solution's within you. You should adapt what you hear, because you're the ones who really understand what's going on. And you're the ones, all of you leaders, will be the ones that actually make the solution. Amir has talked to me about the whole concept of the psychosocial movement that you're preparing and working on. And I just wanted to share just a few views for me. The first view is that your work with the children and young families are very important. It's vital. Because if we're going to deal with the trauma experienced by people who are displaced and in camps, it's really working with children, because they're the next generation. Second is, I think, psychosocial, that is working with families on their needs and supports, is vital in mental health. And I think that what you're embarking on is really important. The third thing I want to mention is when you do psychosocial, oftentimes there's an alternative looking at what we call peer supports. People who are experiencing that trauma sometimes can be your best counselors and support workers. It gives them a role and a job, and they can actually be very empathetic with people who are going through that. So you might want to consider the role of having peers, people who've experienced it, working on the front lines of being able to resolve this. And the last thing I just want to mention is that I know that there's a goal to have a manual in terms of how you work with people within these camps. I just want to suggest you might want to consider in that manual that it takes into consideration the different cultural, religious, and environmental issues that many different people experience, and many ways of being able to deal with it based on their own cultural heritage. So I just wish you, as much as possible, great success. I think that the fact that you're working together, and I really want to say thank you to MHEI for being able to explain what's going on. And if we're able to send some materials and talk with you on Skype and mentor with you and share any ideas, we'd be more than willing to do that. So good luck, and I hope you have a wonderful, brilliant day. Bye now.